The First Coast has seen a distressing rise in an already high infant mortality rate, rising almost 19% in the past 5 years. Here to discuss the infant mortality report that was released just this morning, I'm joined by Faye Johnson, CEO of Northeast Florida Healthy Start Coalition. Good morning.
Good morning.
Also, neonatologist Dr. Mark Hudak. He's a professor of pediatric medicine at the UF College of Medicine, Jacksonville, and chair of the coalition's board. Good morning, Dr. Hudak.
Good morning, Ian.
And Dr. Janet Dukes, Action Plan Coordinator for the Fetal, Infant, and Mortality Review. Good morning.
Good morning.
So, if we can start, Dr. Dukes, infant mortality is a tragedy on a family level, but it is also an indicator of the health of a community. Tell us about that connection.
Yeah, so when we look at data, and we being public health practitioners, we are looking at data on a population health level. And when we see that a community has high rates of infant mortality, that means our most vulnerable populations are having, we're struggling to keep those smallest, most vulnerable humans alive and well and thriving. And so we do talk about that being an indicator for the health of a community overall. Because if we are struggling to keep our most vulnerable populations healthy, then there's a chance that we're going to also see those same trends as we look at the other ages, adolescents, adults, etc.
And Faye Johnson, I alluded to the report that was issued just this morning by the Northeast Florida Healthy Start Coalition. Give us kind of a thumbnail sketch of what your findings were.
Sure. Within this last year, we reviewed the records from 2019. 2019 forward, and we're seeing that there are three leading causes of infant mortality: prematurity, abnormalities, and also sudden infant deaths due to unsafe sleep environments. So, with the data that we have, we're going to be reporting out on the last trend in the Northeast Florida area and looking at all of the results of that and the risk factors that contribute to that.
And you found some good news. There was certain kinds of infant deaths, like SIDS, appeared to be declining, but overall, kind of a troubling picture.
Yes, overall, our SIDS rate has declined some, our unsafe sleep environment, so we're really pleased with that. But you know that one baby dying is too many, right? But as we see that declining, we also, the infant mortality rate did increase.
Dr. Hudak, about 1,300 babies die, about four a day in Florida. Um, and we know that a mom's health before and during pregnancy is a key factor there. What do you see in your practice in terms of an understanding of that connection and an awareness of the risk?
Good question. So, this issue with infant mortality is one that we've struggled with as a community, as a state, as a country for a long time. And just to put it into context, because I think it's not all doom and gloom. Since I started as a physician, we've seen really in the country a dramatic decrease in infant mortality. It's gone down from over 13
per,
deaths
per thousand
per thousand to most recently in 2022 5.6 in the country.
nationally?
However, in Florida and in our community especially, we have higher rates than that. So that's a significant issue. And we have seen issues, as you said, we haven't seen a sustained, really trend to decrease. Although, looking over the past 5 years compared to the 5 years before that, we have seen about an 8 to 9% decrease in infant mortality. But in context of what that means for us, the leading causes, as has been said, of infant mortality relate to things we can't prevent. The number one cause is, congenital anomalies, birth defects. The second cause is one we can't prevent, which is preterm births or low birth rate. The third cause, as it turns out, is this issue with sudden infant death syndrome or sudden unexplained infant deaths, which generally occurs after about a month of age. And we want to sort of emphasize that in the action plan. But really, the issue here is that, and what we struggle with is that, and a major takeaway point on this, I want to make sure the audience understands, is that, we could do really, really good work in terms of improving prenatal care, access to prenatal care. But the issue is what the FEMA report, the Fetal Infant Mortality Review report, showed was that the women who are having babies who die disproportionately have, predisposing problems. They have medical issues, so they are more likely to have diabetes or hypertension or be obese or have other issues that impact the health of the fetus. They are more likely to have issues in their lives which are stress issues, which may relate to insecure housing, domestic violence, interpartner violence, food insecurity, those sort of issues, which really elevate a woman's risk to deliver preterm or have a low birth weight infant. So a lot of these things, we call these social drivers or social determinants of health that are sort of not considered classically medical, but they have a huge impact on a woman's health and her ability to have a healthy pregnancy that she brings to term. So the issue here is that prenatal care can't fix that. It can approach a little bit, but this is a generational issue that we have as a society to figure out how to provide the supports for women and fathers, as they're growing up from very young to when they get to be able to have children, to be in a healthy spot, both physically and mentally, so that they can have a healthy pregnancy and reduce mortality that way.
I want to ask you, Dr. Dukes, because we know that, and the research has shown here and elsewhere, but very much so here, that there is a large racial disparity when it comes to the health of the mother and the infant mortality rates. And in this area of Florida, regionally, I believe it's about 3 times as many Black babies die as white babies.
Yes, absolutely. And it's something that it's not just Jacksonville, Florida, or Duval County. If you look at different states and cities across the country, you'll see the same thing echoing in those neighborhoods. In some neighborhoods, 3 and 4 times the rate of deaths among African American and Black mothers versus their white counterparts. So it is something that we see in public health. And that we look at and talk about a lot as it relates to birth outcomes. It's probably one of the areas that you most readily see the disparities present.
How is that issue being addressed specifically in a way that, tries to target that problem as opposed to just more broadly the issue of infant mortality?
Mainly by addressing those social determinants and kind of conditions that Dr. Hudak just spoke about, looking at ways that we can help support women in our community in terms of housing, in terms of food insecurity, in terms of those stressors that are having an impact on their health on a day-to-day basis, because we know that not everyone experiences those same determinants or those same outcomes in the same way, depending on what your zip code is, depending on where you live, your neighborhood, your access. And so giving those women that may be more predisposed to some of those issues or to needing more support, tailoring our interventions where we're keeping them in mind and really getting at the heart of some of those issues.
Faye, what is the role of the Northeast Florida Healthy Start Coalition in delivering the message and also helping the community?
The Northeast Florida Healthy Start Coalition began in 1991, and we serve the Northeast Florida area. And we have many programs across the Northeast Florida area that provide home visitation services, community resources, education, all those kinds of things in our area. So with the Northeast Florida Healthy Start Coalition, we serve about, I guess, over 7,000 families a year in the Northeast Florida area, but we cater our services, we meet them where they are. We are tailored to the families that we serve. We focus a lot on the Black infant mortality and maternal mortality as well in the community, and we bring a lot of resources and education to that subject.
I want to throw this open to any of you who want to tackle it because it is a little bit dicey. But I mean, one of the questions that comes up when we're talking about carrying babies to term and them not being healthy is the question of how a more strict abortion law impacts that. If it's harder for a woman to abort a pregnancy, will these rates of infant mortality increase as a result?
Right. So there actually there actually are some preliminary data on this. Study just came out this week, published in the Journal of the American Medical Association Pediatrics, that looked at the trends in infant mortality after the change in the reproductive rights 2 years ago. And they have concluded that there has been because of that, 7% increase in infant mortality that's related to primarily, women being forced to carry to term babies who have, fatal congenital anomalies, birth defects. So I think that's just a window into the problem. But there are all sorts of issues associated with, that change in the status. And, we will see definitely more babies born with, bad congenital anomalies and so forth. So that's the data so far.
If you're just joining us, we're talking about a new report issued today by the Northeast Florida Healthy Start Coalition on infant mortality in the region. If you want to join our conversation, you can give us a call at 904-549-2937. You can also email questions or comments to firstcoastconnect@wjct.org. You can also reach out on social media. We do have an email comment from Michael. He says, it's not like Duval's high infant and maternal mortality rates are new. I say this not to demean the many people working to improve the situation, but as a criticism of local and state elected officials who are more attracted to shiny ideological objects, such as the right to life. What has the state investment been or interest in this topic,
Sure.
Faye?
Sure. Well, I'll start with the city as an example and then move through the different levels. We are fortunate in this area to have the investment of the city and the mayor's office around this topic, and they are very invested in it. They have provided funding to support some of the initiatives around infant mortality. They provided funding for community health workers that go out into the community and identify families and bring them in. And so we have a very committed community here. At the state level, we're funded through the Department of Health that funds our fetal and infant mortality review process completely. And from the federal level, we're funded by the Federal Healthy Start Project. So we are have partners
And is that
across.
funding sufficient? And is there any impetus to increase it or to give you an opportunity to broaden your footprint?
It would be great if it could be increased so that we can not only focus on one or two or three or four zip codes, but the entire Northeast Florida would be helpful. So funding is a wonderful thing, but to increase it would be even better. But to increase it also so to address the social determinants of health and to go upstream as we look at the children that will become adults one day. I think that's a particular area that we need to really focus on, the preconception health.
So the disparities, in terms of health, racially speaking, um, is well known. The science, though, on the kinds of stress that some communities experience is sometimes called toxic stress that can impact a woman's health and particularly maternal health during a pregnancy are things that we're starting to learn more about every day and some that we never really even considered. Traffic noise, neighborhood crime,
Mhm.
heat, which has become a much bigger issue, obviously, here in Florida. Um, and it's almost hard to keep up, uh, Dr. Dukes, with the changing science and learning all the time about new potential impacts.
Yeah, absolutely. I like to think about it one way I explain to my students when I'm teaching undergrads is think about where your most calming environment is when you have a test, when you are studying, when you are cramming, and think about how you feel. And then think about after that final exam has happened and you're able to relax and where you're able to go to just kind of mellow out. Imagine if you never had that opportunity to turn off and to come down from that stress level that you're constantly feeling, that angst that you were feeling going into the exam. If that was life every day, worrying about bills or worrying about food or worrying about all of these things and never having that opportunity to go and hang out and zone out with your friends afterwards. That's the life of some of those women. And if you're carrying a baby, it's impacting that baby on a day-to-day basis. And so that kind of is a very low level way of explaining kind of that toxic stress that's kind of impacting these outcomes.
But the stress, I mean, research has shown that persists on a racial basis beyond economic or social setting, so that, professional Black women have that same risk when it comes to their health and the health of their child, even if they're well off, even if they're living away, in a secure neighborhood that's safe and have the other benefits that might accrue to, a more affluent white community. Those death rates still are a factor.
Yeah, and I think the research is very blunt about it. I mean, it comes back to kind of the racism that's kind of experienced by different groups of people that others don't have to. Just the simple example of walking into a store and you being looked at in a way as if you were going to steal something or take something, and someone else not having that same stressor. So that doesn't matter how much money both parties make. Just the simple that one is a black woman or a black man walking into a store and already getting that kind of discrimination versus someone else having that. That in itself is something that plays on us day to day. We are a product of our environments and our experiences.
Yeah, we've got a call from Tim in downtown. Good morning, Tim. Go ahead.
Yeah, good morning. Thanks for taking my call. My question is this, I'm just wondering what the infant mortality rate and the maternal mortality rate is for year 2022 and year 2023. Do you have those figures handy that you could give those to me?
Thanks
So,
for the question, Tim.
so for the United States as a whole, the 2022 infant mortality rate was 5.61 per 1,000 live births. I'm not sure that the final numbers are out yet for 2023. Maternal mortality rates have fluctuated in the past few years quite a bit. They were quite high during COVID when many mothers died of that disease. So they were inflated during 2021 and 2022. But nonetheless, I think the pre-COVID maternal mortality rate was about 17 per 100,000, which is much higher than the rates in other countries similar to us.
And compared to that 5.6 nationally, in Duval, I believe it's 7.2,
7.9
7.9. So
per 1,000, right?
significantly higher. Um, and so, what are next steps, Faye? I mean, what happens with this information now that you've got it in hand, this 5-year review?
Sure. So at today, as a matter of fact, at 12 noon today, we're going to reveal the data, that data presentation that will be virtual or either in person, but mostly virtual today at 12 noon. The Northeast Florida Healthy Start will put out the complete data report on that. And then the recommendations with that is looking around things of still addressing the social determinants of health, also looking at reducing sudden infant deaths, safe sleep deaths by 1 point, I think it's 1 point, I'm sorry, but reducing that as well. That's one of the recommendations. And then the third recommendation is to look at going upstream around policy issues and addressing some of those things that impact infant mortality as well.
I just want to read a comment from Shawana Brooks on Facebook. She says, I have an exhibition around Black motherhood. It's called Magic, Mirth, and Mortality, Musings of Black Motherhood. It's online and can be found in person. So thank you for being here this morning. Thanks for sharing this information with our listeners and for talking about this important issue. Faye Johnson, Dr. Mark Hudak, Dr. Janet Duke, really appreciate it.
Thank you.
Thank you.